Hi, I'm Gina Poisson. I'm a clinically licensed marriage and family therapist here at Living Hope. And this is a great place for patients to come who are suffering, of course, with eating disorders. And we have a variety of different modalities that we use to address that severity, the symptoms our patients exhibit. And so I'm going to take a minute and let Cassie introduce herself.
Hi, my name's Cassie. I'm one of the 30 dietitians that we have here at Living Hope. Our main job here is to provide meal plans for the patients and based on their needs. And we also do nutrition education classes and take the patients on snack outings as well, just so they can get some food exposure too.
I think the role of the dietitian is just as equally important as other roles here as therapists and so forth. And so basically, we have to kind of work in tandem with the patients many times because we really need to address all the symptoms. And so a big part of that is the nutrition. And as a therapist, we have, like I said, different modalities. So we have trauma-centered, client-centered therapy that we utilize, solution focus, motivational interviewing as a different cognitive behavioral therapy, certainly. And so this is a very relaxed setting for patients to come in and sit in this living room. And then we also have the clinic, of course, that was mentioned earlier by Dr. Sears, and that clinic also addresses the severity of symptoms. As a therapist at the residential site, we actually meet with our patients 3 times a week. And so that provides a lot of opportunity for that patient to really work through any trauma from the past and or the current symptoms that are being displayed while they're in treatment. And so we're able to readily and very accessibly be accessible to our patients and really service their needs, on a every other day basis. So I really feel like we really address their needs very well here. Yeah. What do you think, Cassie?
Yeah, absolutely. As dietitians, we meet with the patients 2 times a week. The sessions typically range from about 45 minutes to an hour. We also develop the menus too. I forgot to mention that earlier. So we're creating the menu and then giving it to the chef.
So yeah, and then too, I know we do exposure therapy as well with the nutritional part of that as well with the therapy. So we actually have outings that we do here with our patients when they're ready. They have to be at a certain level in order to go on those outings. But we do provide that as well. So I think we have a very well-rounded approach here at Living Hope, along with the psychiatrist that they meet with on a weekly basis, and of course Dr. Sears on a weekly basis. And so I think it's just a very well-rounded approach in a beautiful setting to provide these services.
Absolutely.